Both of us worked in the corporate clinic for a while before deciding that we wanted to open our own practice. For me, I think I was very clear that I wasn't liking the way patients were experiencing dentistry. I wanted to give them a better experience wherein we empower them to, take a lot of control over their own oral hygiene. And we do this with a lot of education. We spend a lot of time with our patients so that they can kind of understand the importance of oral hygiene, which I felt was missing. And I think that's the main reason why I opened my own practice. And I think she had a very similar story as well.
It was a very different experience of dentistry for me because it was like the first job right out of college. I was in heaven. I got to work with the best cases, the best technology there was to offer. I was loving every part of it. I think what changed was just for your own personal individual growth as a clinician, the kind of treatments that you want to practice. Sometimes with corporate chains, it becomes very repetitive, the kind of treatments that you're doing. Introducing newer methods, newer techniques for the betterment of our own. I think it's a selfish move also, but I think for my own growth as a clinician is why I thought the next step would be to have a good setup, which is again sort of built from my understanding of what dentistry is, rather than being a. I had fun. I had a lot of fun working in that place. I worked very hard in that place. What I remember of my first patient is that it was a filling. It was a silver filling. Whether that tooth could benefit from other types of filling materials, if I could have done a different technique, all those complicated things at that time all you want to do is simple steps, because it's your first patient, it's your first experience on a human being. Even sitting down and starting and using those very fast machines in the mouth, I just, from that to this, the journey has been very, very different. And I think every part of that journey, including having an experience in corporate chains versus working with individual practitioners, working as a consultant in different clinics, and now to having my own place, it's been a journey. And I think every part of it has been equally important to shape us and our understanding of how we want to practice.
Why do I remember my first case to be an extraction?
Good, na?
Are you sure that we even do
No, but
extractions at that time? Because I remember
yes.
that थर्ड ईयर में एक्सट्रैक्शन
थर्ड
किया
ईयर
था ना.
में थर्ड ईयर
मोबाइल
में
टीथ के
मोबाइल टीथ
एक्सट्रैक्शन
के
करते
एक्स्ट्रा,
थे ना.
yes.
हाँ.
So because our batches were different, no, I would have been in cons,
Yeah,
you will be in
probably
OS.
because I remember my first patient, not a filling patient, but an extraction patient. And I loved it. Was obviously a mobile tooth because it's your first patient. They won't give you one of those hard teeth to pull out. It was almost literally in the air, and you had to just hold it
Mm.
and pull it out. But
But even giving that
that,
anesthesia.
yeah, I was excited about that. I don't know why that is like. I remember that हिलता हुआ दांत जिसको मैंने पकड़ के खींचा था, and I was very excited about it.
Good.
That was my first
See,
patient.
that's how it shaped. That's why it shaped. Like I started with filling, and I remember spending a lot of time carving it and
Probably.
making the occlusal fissures and all that. And you started with surgery.
Yeah,
That's
yeah.
when it started.
Probably because I don't know, even in the during lunch when you were saying filling, I'm like, why do I remember it to be an
No,
extraction?
but we were in
एक
different
हिलता हुआ
batches.
दांत को दिया था मेरे को, but
Mm.
that also was a big deal
Big deal,
because it was
yeah.
the first case.
We don't do filling silver fillings anymore.
Anymore. We don't do silver
No, but
fillings
hardly any
anymore.
practices you will find having silver fillings. In fact, one of the treatments that you do is replacing silver fillings with newer materials, which is your tooth colored materials. Because bonding, so the difference between
So
those.
much has changed. We used to spend, I remember this entire day where my professor made me make an impression. An entire day, I was making only one impression, 8 hours. Nothing was good enough for him. He's like, this has not been recorded, that has not been recorded. Repeat, 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 repeat. For 6 to 8 hours, I was doing one impression versus now where we can just do a scan.
A digital
Nobody, in fact,
impression.
one of more and more people are going to stop using impression materials. They're going to start using intraoral scanners. Everything is digitalized. The whole digitalization of dentistry itself is such a huge leap and bound forward in the field of dentistry. And yeah, all the different types of materials that have been used. We don't do silver fillings, we only do tooth colored fillings. And
Bonding in dentistry is a huge thing. The way materials react to your tooth versus previously just cements were used. There's a lot of material advancements also happening along with technical advancements. Like, for example, anesthesia that was used before versus the anesthesia that we use now. We've got multiple devices that can offer an absolutely painless experience, because that's the first thing that the patient is fearful about: needles. There is so much more that has come in which you really won't realize any sort of pain that is associated with the name dental or dentistry as such. It's a very different experience now, and I think people should get to know that more rather than having that same picture of what dentists can be.
and that's what I think. So it brings in so much fear in patients, because the age-old idea of what a dentist is and what dentistry is and what kind of treatments happen in dentistry. Like, I think 60% of the cases, the solutions in previous days were extraction.
Mm.
People wouldn't take that effort to, let's
Effort.
say, do a root canal or even a post and core, try and save the tooth. It was very aggressive. So you see so many young people, even in our generation, I think, with extracted molars, which
Mm.
is so sad, because I think today a dentist should, if he doesn't, and definitely does, think a gazillion times before extracting a
Extracting
first
a
molar.
tooth.
We just don't, such a primary tooth, and we'll do everything under
And
the
plus,
sun to
doing
try and save it.
extractions without actually explaining the replacement methods, I think, should be a standard protocol for everybody.
Everybody.
If you are doing an extraction, you make sure that you've spoken to your patient about the replacement option and how soon they need to get it done. Because once the tooth is extracted, yes, it's gone. But what is going to happen is the teeth adjacent to it, the tooth above it, everything is going to shift. There's going to be a shift and the balance is going to go off, and that's when most of the problems start. It can either start from basic gaps in your teeth, and then as you wait longer, the replacement of that tooth becomes even more difficult. And this is such a basic thing that we as dentists take it for granted that we know, but patients don't know that if I wait for a longer time to replace that tooth, my procedure becomes more complicated, more expensive, and the prognosis is affected. And whereas it was just a simple thing that if we are sitting down and we are talking about removing, extracting a tooth, let's talk about replacement. Like how amputation probably is treated, I don't know if I can compare it, but you are going to choose the method of amputation depending on the kind of prosthetic that will fit the lifestyle of the patient at that time.
If you're
So,
amputating a leg, as opposed to just thinking about, okay, we're going to amputate it without talking to the patient. That's as unacceptable as that is. This should also start becoming a
a
standard
norm.
protocol and a
Yeah.
norm, which it has, I think. So there's a lot of advancement in dentistry, and the as she said, the entire experience can be so painless. And if the dentists themselves can make a little bit of an effort to try and create a better experience for the patients, and you bring in a lot of awareness, make some effort to bring in a lot of awareness, then I think the whole experience of dentistry can be changed.
And it's changing, which is good. It works both ways. I think patients should also demand a kind of standard for their treatment. Say, for example, the moment your patient steps in, the first introduction to your dentist, if your dentist is making you feel, first of all, comfortable in the chair, instead of like the first key concept, I think, of slow dentistry is to take your time with your patients, make them comfortable on the chair, because what that does is that eases us also when we are working. Secondly, because of intraoral cameras, whatever I am seeing, what when I'm checking a patient, when I'm doing a comprehensive evaluation, we can show the same thing to you in front of your eyes with the help of cameras. It's not very easy for you to be able to see certain areas of your teeth, obviously, which we can take good images for and actually explain to you where that problem is happening, where your food is getting stuck, where probably you are not able to do enough cleaning, especially at the back of your mouth. So that visual representation again puts things into perspective for a patient also.
And nowadays, I think most clinics, including ours, have full mouth x rays under one roof, individual x rays. You can take a very holistic view of the entire mouth and sit and explain to the patient. Even in layman's terms, they understand when you show the x-ray, when
Mm.
you show the intraoral photo, compare both of them and try and explain to them what is wrong, that itself is such a huge advancement in terms of the patient, from the patient's point of view, because even before extractions, you know, so many
Like
years
the
ago they
you
wouldn't take x-rays, so this kind of a availability of technology and ease was not there. So I
and there
think,
was no cookie cutter like treatments. Like everybody was not. It's not just because you've got pain, so means root canal is your only option.
yeah.
That's not the case anymore. You sit down, you diagnose. In fact, even with root canals, x-rays, two-dimensional x-rays and three-dimensional x-rays are changing the way, even where how you approach root canals. For example, if a tooth has a difficult not a difficult anatomy or a different anatomy, we can gauge that better with the x-rays rather than being surprised when you are doing the treatment, thereby actually preventing a lot of mishaps also that can happen in root canal. So many things have been eliminated. Like we can measure the distance between top of your tooth to the apex of your root very very precisely with apex locators. We do use magnification to see very very clearly as to how the tooth and how many nerves the tooth has. So every part of dentistry has so many things that have come up.
So basically, with the patient itself, they have a lot more
Mm.
options. It is not like, you would go to a doctor and with a problem and he would give you one solution and you have no option but to just go through. That's not the case anymore. Actually, a good dentist spend a lot of time with their patients trying to tell them the different approaches to their problem.
Mm.
It's not a single, as she said, it's not a cookie cutter approach. There's so many multiple ways you can approach that problem. There's so many schools of thought that go behind, what treatment could be better for that particular person. And if the dentist makes some effort to sit and explain the whole thing to the patient, then they can be quite empowered to take their own decisions as per what is important for them, what could be important for them. I think that's where patients are benefiting a lot these days, because they are demanding information from the doctors, as even before, even not only after coming into the clinic, even before they come into the clinic, almost all practitioners have websites, they have Instagram handles, they have so much information on Google about each and every doctor, the kind of work they've done, etc., that patients are quite well informed before choosing their dentist and doctor. After you come also, all these diagnoses that we do is so that the patient only understands now that what's wrong.
What's wrong and how to treat. Like for you also, for example, we gave you, there were multiple ways we could do your treatment.
Treatment, we could have done
There
crowns,
are
we could have
pros
done
and cons
veneers, we
for
could have done.
everything, but what fits you personally better. Like we spoke about your first option, where according to me the most important thing is to have the discipline to actually do the treatment. Once you as a person, as an individual, feel that yes, I can probably devote that much time to my teeth and I would want to take that approach, it fits you. Whereas another person who can say that I don't think that I work too much, or I have commitments throughout the day. I don't think it would be
And I
feasible
don't
for
have
me
the
to
time to,
time
let's
to
say, 6 months, 8 months, I cannot spend on an
spend
aligner.
on
So
an
I want a
aligner for
quick
my teeth. I
fix.
want I want something that will improve my smile, and I have limitations of this time because they have an event, they have a wedding, anything can be the reason. So the second option of veneers is a good fit for them. So actually sitting down, listening to your patients to
An older
understand.
patient, let's say with very poor oral hygiene, we wouldn't even give certain treatment
Mm,
options. A younger patient, we wouldn't give some other kind of treatment options.
yeah.
So it all depends. We try and customize treatment options for our patients so that they can kind of get what they're looking for while maintaining the standard protocols of treatment.
All we are trying to say is that have an awareness that this is a very important part of your body, and pain is a good indicator. All we are trying to say is pain is not the only indicator. Bad breath is also an indicator. Discoloration of your tooth is an indicator. Certain different tastes in your mouth is an indicator. Food getting stuck in your mouth is an indicator. All those things apart from pain, there has to be. And you cannot blame anybody that they are waiting for pain honestly to come because of various reasons. But there can be multiple. Being just aware of your mouth, say for example, even if you're eating, preferring one side to eat than the other, why? If you're waking up in the morning with some jaw pain or with some headache, probably why. Are you seeing some changes in the shape of your teeth as you are getting older? Because a lot
Shape,
of
color,
color,
is there any more sensitivity to certain foods than there was
even things
before?
like sensitivity, for example, there's hypersensitivity and there is sensitivity. Your teeth, your second layer of your tooth is more sensitive to temperature changes, to pressure changes, which is a normal response of your tooth. That's why it's got nerve innervations. But sensitivity lasting for more than a few minutes is hypersensitivity, and that might need probably some treatment or intervention from our side. But sensitivity, on the other hand, is normal. So, knowing these things about your body, being aware of those facts is what is
Yeah, I think the urge here for both of us is we're trying to urge our patients to be more mindful
mindful.
about
Yeah.
their dental treatments and their oral
Oral
hygiene
hygiene and
and
health, otherwise,
health.
also. Like so many of the patients that I'm seeing nowadays come with a lot of issues with grinding. Stresses have increased. We live
Lot
in
of
a very
mental health.
health stresses have increased. So most of them they don't realize, but sometimes when sensitivity is increasing, it's because you've you have probably some night grinding issues, which is why your teeth are changing shape. They probably are getting shorter than what they were before. They're developing some cracks, so you can see some jagged edges on your teeth. All these are signs of probably attrition, which is grinding your teeth, or our diet, which can be more acidic. The number of times that we have coffee, the whole coffee culture. I love coffee personally, but it's not something that is very good for your oral environment because it turns your mouth acidic, which again is an environment where enamel is not very happy.
On the other hand, don't self-diagnose. Like they said that, like she said, there's so many different types of sensitivity. You will need an expert to try and guide you towards whether the sensitivity actually can be addressed, should be addressed, and what is the best way to address it. As opposed to just looking at an ad on a TV and start using
Using a
desensitizing toothpaste without actually understanding what is the
yes,
cause of it.
please, please, please don't use those toothpaste for a long time. I'm sorry, but
Yeah. So basically, what we are trying to say is that there's so much information out there. There's so many different types of treatments. There's so many problems, and everybody needs to kind of find the right person for them. Choose your dentist wisely. Figure out what do you want to do and what kind of school of thought or treatment approach works well for you, and try and build more personal relationships with your dentist and give a lot of importance to your oral health because it's very
yes,
much
more than
interlinked
enough
to
studies
general health.
available
Yes.
to give the importance of oral health now. Don't think we should ignore this. There's a more ample of studies available to understand the link between oral health and your general health.
General health. So don't ignore oral health. Thank you, Dr. Ankita, for joining us today.
Thank you. It's an amazing clinic, first of all.
Thank
It
you.
honestly is an amazing clinic. It shows how much effort you've put into creating an environment, how passionate you are towards your work. And it's inspiring, honestly, because the kind of work that you do, be it in terms of just your specialty or versus the other doctors also that you are calling in, it feels nice. They've got good vibes.